Hi, good morning. May 1st is a mental health day. And to increase the awareness, we have two very special guests. Um, one, Dr. Eyyunni is a ENT surgeon by training and practice, but she has an outreach program for mental health awareness and has been very active in spreading the word about the stigma of mental health disease and various issues that the Indian Americans as well as Indians face. My other very special guest is Dr. Reena Khanna-Goyal, who is a clinical psychologist who is born and brought up in the West. However, she has been in practice for 20 years and is very aware of the situation both in the West as well as in India. So let's start with some very basics for the mental health awareness. Um, First issue is I noticed that there's a lot of stigma about mental health disease, what it is, and when to seek help, and various issues. So, would you like to comment on that?
Yes, there is a tremendous stigma, especially because there is always supposed to be a cause and effect phenomenon. If a child is not doing well, it's either the mother didn't do right or the dad didn't do right. So this is a very, very prevalent generally, as well as in Southeast Asian families. And especially when they are in a different culture, this seems to be exaggerated. So, because of cognition of this particular situation, some of us got together. Dr. Reena is a psychologist, as you already mentioned, and we have a psychiatrist from Mayo Clinic, and I have four very good friends who are computer oriented. So that, we started this in 2010, and it's an interesting thing. Our organization is called Mothers Cry, and it's not a mother sitting and crying, for heaven's sake. This is an acronym for M for mental well-being, outreach, therapy, therapeutic guidance, help and hope, empathy, which is really, really lacking in many of the families, resources, support, challenged youth, rehabilitation and recovery, especially the youth. The reason we chose for the youth is that irrespective of which nation we are living in, youth seem to be caught between the ambitions and of expectations of the parents and the families versus their own capacities. And Dr. Reena would be a better person to explain this.
So, Dr. Reena, do you want to elaborate on those?
Well, I think it's lovely to be here, by the way. Thank you for having us. Of course, as Dr. Uma said, Mother's Cry is a very important organization that she has pioneered and started. And we are very focused on destigmatizing mental health, especially in the South Asian community. But I think stigma around mental health exists pretty much across the board. I think it is much more intense in certain cultures. There's so much fear and misunderstanding about mental illness. It's usually seen as a weakness, it's seen as a failure. And so, for those reasons, mental illness is not considered a medical issue, which
Yes.
is a very big misconception because mental illness is not a choice, it's not a weakness, it is an actual medical issue. And I think because of the portrayal of mental illness in media, over the years, people have been institutionalized. So there's so much misunderstanding and fear around mental illness in general that it really, really creates that not only for families and systems, but also for each person. They feel a lot of shame often with that. So I think that's something we're trying to just in general in the whole population, because I think there's a statistic that almost 50% of mentally ill people in America even don't seek out mental health services, which is very, very high. So it's really something that we have to educate people and we have to open the conversation, especially for families, like you said, the guilt and the shame associated with it. So really looking at all those factors, and Mother's Cry is very focused on helping people understand that this is not their fault. It's nothing to be ashamed of, but it's a problem to be handled.
Dr. Reena, what are the top 5 mental health challenges you see in US children of Indian origin? And is it the same in India as well?
So it's very interesting. I will just list off the top 5 psychiatric diagnoses in the United States. Those are anxiety disorders, generalized anxiety, or specific phobias, panic disorders. The second is major depression, major depressive disorders. The third is substance abuse disorders. The fourth is post-traumatic stress disorders. And the fifth is attention deficit disorders. So those are the main ones that are diagnosed in the United States. In India, it's a little bit different. The number 1 is depressive disorders, followed by anxiety disorders. Substance abuse disorders are very prevalent, especially in the male population in India, they found, in particular with alcohol and tobacco use. And psychotic disorders and bipolar disorders are also on that top 5 list. And for your viewers, psychotic disorders and bipolar disorders are probably, we see them as more on the severe side of a little more serious, not to say that the others are not, but they're a separate class of disorders. And the thought is that there's more psychotic disorders reported in India because it seems that people are not reporting or seeking out help until there's some disruptive behavior. And there has to be a very extreme behavior in general for people to seek out help, so that therefore those ones get over-reported, as opposed to anxiety and depression, which I think a lot of people feel you need to figure it out yourself, you need to deal with it, you manage it. So that's very interesting. There is some overlap, of course, but that was a very interesting point, and it really speaks to that stigmatization and underreporting and the shame involved with that, with mental
And
health.
if I may say something, Reena, we always talk about this. Many of these challenged kids, they are not the ones are perpetrators of any violence. They're more or less, they are the victims. The community does not seem to appreciate that fact. So I think that is another thing that we are trying to do, is break that kind of a situation wherein there is more knowledge, because it's a neurotransmitter disorder. It's not that, I think these terms are used very, very loosely.
Absolutely.
So
Absolutely.
you have a lot of these, the prevalence in the community is pretty high, even here. And generally, we think like a patient who has schizophrenia, or like you said, very obvious behavioral disorders, those are the ones people think that they have the mental illness. And like you mentioned, all the others are a lot more prevalent than these extreme psychosis or psychotic diseases. So in your practice, you're a clinical psychologist.
Mhm.
So you are treating mostly anxiety disorders, or what would be your top 5?
So I am a general psychologist, and I would say that I see a number of anxiety disorders. Anxiety and depression often can coexist. So sometimes you don't have one without the other, and they kind of take turns. But I would say that anxiety is probably the number 1, followed by depression that I see. I also see a lot of attention deficit these days in the population, in the youth. Seems to be increasing. And I'm happy to report that I'm actually seeing a lot more Indian patients who are coming forward and seeking out treatment. And, I think it's very helpful to have that cultural sensitivity and understanding of the cultural factors that go into their getting the treatment. So it's actually very hopeful to see that more people are coming forward. And
So how prevalent is the fact that you're kind of a transplant from another culture? Like, there may be first generation. I know you're born here, so you're like our kids. So how important is it? Because for us, we've been transplanted, but you guys are born here. But at home, you have a different culture than what you're exposed to. How much of this um, almost dichotomy or schizophrenic, outside is different world, home is different world? How much is it playing a role, you think, in anxiety or any of the mental disorder, or even expectations?
Yeah, I mean, that's an excellent question, actually. I think that, and we actually recently did a seminar on this with the kids, with the youth, talking to them about this very topic,
Yes.
this kind of dual identity. So I grew up in the 70s and 80s, and things were, my parents had just come from India, and things were very different. The exposure, globalization was not a thing. So it was very different, yet when I talk to my patients, a lot of the youth who are like me, born here, they have the same challenges that I did. So it's very interesting that even though the world has changed tremendously and so much is so different, those challenges remain the same, and how they are managed remains the same. I think that I feel really blessed and lucky to kind of be in this situation, because I have the advantage of having experienced it, but also as a mother, I've also been challenged as a parent raising, Indian children in a different culture. So it really is a very big factor. The expectations, like Dr. Uma said, expectations of parents, of society, of community. It, I think,
So
imposes another level of stressors for
I
our
think the
youth.
expectations of the
Yeah.
kids of themselves is also a big factor,
It,
because
yeah, it's
everybody
very
is professional.
interesting.
Yeah.
Right. I need to quote one of the young ladies that I met. She said to her parents, "Your expectations should not become our obligations."
That's
Yeah.
a good one. That's a
So,
good quote. I like the quote from the young lady. So give us 5 tips, Dr. Reena, that our viewers can take away to fight the stigma, number one. Number two, when do the parents get worried? When do they need help? When do they need to seek yours or a psychiatrist's help?
I think 5 tips are one of the most important things is an open mind, communication, and psychoeducation. Really, really getting the word out there for people so that they can understand. I think one of the most important things I try to tell parents is, if just listen, right? It's very difficult to not speak, to not react. As a parent, it's difficult for me at times, but the more we listen, especially in today's world, our kids are exposed to so much. There's just it's a very challenging world to live in. It's beautiful, but also very challenging with all the advances. So really, really communicating with your children, listening to them more importantly than anything, helping them not be afraid, managing our own anxieties as parents and our own struggles so that we're not displacing them onto our children and adding that extra pressure is something I think that's very, very important for parents to understand.
go
What are
ahead.
the signs that the parents should look for and seek professional help?
So, I think anytime we're having that question, should I seek help? Chances are that you should seek out help, because something is telling you that things are a little bit more than one can handle. I think that, these days therapy is becoming more and more normalized. I think it's a great outlet as society changes. It's a good place to, have someone, an objective place to talk. I think it's always a good idea. For many of us. But really, if you're seeing behavioral changes in your child, you're seeing changes in their sleep patterns, their eating patterns, isolation is a very, very big one. I think especially amongst our South Asian youth, they tend to shut down a little bit more than exhibiting disruptive behaviors, I think. So these are things I think parents really, really need to pay attention to. And asking them the questions, right? Really asking them and listening. A lot of times we talk at our children and we don't give them a chance to express themselves. So really asking questions, what's going on? Are you okay? I noticed you're doing this. You're in your room more. Is there anything I can help you with? And I think that goes a really long way with kids. It's simplistic, but it really is important. And it's hard to do when we as parents get anxious or worried or concerned. So really slowing ourselves down so that we can do that for our
The
children.
main
So what we
points,
do,
yeah.
I'm sorry. So what we do as a principal, at the end of every seminar, we say to the parents, please listen more than you talk.
Yeah.
I agree with that.
So the number one is communication, open communication. Let the kids do the talking, you do less talking and be open-minded. And secondly, if you feel something is off as a parent, you know that that's not normal for the kid. Don't be afraid to seek professional help. So it doesn't have to be somebody else telling you your kid is, somewhat off. You know it before anybody does.
Absolutely. So with any medical illness, if we're worried that you have a cold or you know something's not right, a blood work is not right, we don't hesitate. So in the same way, I try to talk to people about the brain is another organ, like the rest of our organs. We don't try to convince our pancreas to, work properly for a diabetic. We don't try to convince our hearts to beat accurately for an arrhythmia. So in the same way, we shouldn't put that pressure on ourselves, like let's get help. As Dr. Uma said, there's neurotransmitters at play. The brain is an organ like any other organ. So really take care of it.
Thank you so much. This was very, very helpful, Dr. Uma and Dr. Reena. So we will continue this conversation because I know we can't cover all the topics, and I'll give the links to all your movies and the organization and the seminars in the text. So very nice. Thank you and good night.
Thank you.
Thank you very much.